Former President Joe Biden has re-entered the headlines over the last month. Most recently, it's because he's been diagnosed with prostate cancer.
Yeah, Biden's team says he was diagnosed on Friday. They're calling it an aggressive form of cancer that has already spread to his bones.
9 News medical expert Dr. Pyle Coley joins us now for really a discussion about the president's health. And we should say, full disclosure, we're covering this, we're watching this story from a distance. So, it is tricky for you to talk about the specifics. But just in general, I think the one thing that took us all by surprise, this is, former president of the United States. If he's not getting the best care in the world, who is? How did it get to such a late stage?
Yeah, one can imagine it was probably spreading during his presidency because it's already spread to his bones. But I really want to reassure everybody that this is probably not a lapse in care, but more sort of a question of whether we need to change our guidelines, because there could be one of three scenarios. The first is he wasn't getting regular PSA screenings or screenings in general. As the president, that's usually not common because you have a personal physician who checks on everything. The second is the cancer props up between the screenings because it's usually a 2 to 3 year interval between the blood tests. And if you have an aggressive form of cancer, it's possible, even if you're getting that blood test every 2 or 3 years, if you don't check in the middle, the cancer could be growing during the time. But for him, I think probably what's most likely is that after the age of 75, we usually don't screen people for prostate cancer. We don't screen older Americans for prostate cancer, and that's the guidelines that we've written.
Speaking of those guidelines, obviously in this older population, are there other cancers where we typically just stop screening because of age?
There are. So cervical cancer, usually around the age of 65. Colon cancer, 75, they start to question, and then definitely not after 85. And then breast cancer as well. There's sort of mixed data after 75. But the medical community, myself included, is really starting to question. Age is an arbitrary number. So should we just be using these random cutoffs? And the theory behind why we do this is because as you get older, obviously the benefit of screening goes down. Your life expectancy is more limited, so the return on investment from the screening goes down. And the risks of screening, like a colonoscopy, for example, could potentially be higher.
Any chance that guidelines change, especially this is obviously, a high-profile case. Do you think that things are changing?
I think they are, but not fast enough. And I would say as a physician, what I'm hoping for is not, okay, you're 75, we stop screening, but instead you are a 75 that has the sort of health of a 65. Yeah. You're active and you're intellectually active, and we should keep screening you because your life expectancy is at least 10 years versus you're a 75-year-old who's had a stroke and has dementia, and that's not a person you keep screening. So I think it shouldn't be a one-size-fits-all. We really need to evaluate the individual, not just based on their chronological age, but their biological age, their sort of functional age, and then make a personalized cancer screening plan. The challenge with that is rolling it out on a population level. It confuses doctors, it confuses patients. You don't really know where you fall. And so I think it'll take some time for the guidelines to get there, but I'm thinking we're getting closer to that. We're also starting to use more imaging as screening, which is less invasive, non-invasive imaging or biomarkers and blood tests rather than invasive tests like colonoscopies.
We've seen some of these age limits change. What can younger people do to increase screening and awareness of their cancer risk?
So this is so important because cancer used to be thought of as a disease of aging. Yep. Now it's really going after the younger people, and women especially need to be aware of this as well. So I would say it's never too early to start thinking about your cancer risk. The first thing I tell my 20 and 30-year-olds is family history. It's your genetics is one of the biggest predictors of your cancer, especially the types of cancers like prostate cancer, breast cancer, and such that can have genetic predispositions. The second, don't ignore symptoms. We've talked about on the show before, you've got a stomach ache or at least satiety, something like that. Don't just blow it off and say it's nothing because you're young. You want to make sure that you talk to your doctor early. And then the third, which also we sort of forget about as young people when we're busy, is screenings. HPV vaccine is one of the most important interventions we can do as a young person to reduce our risk for cervical cancers and oral cancers, along with colonoscopies, which we're now starting to do at 45 instead of 50.
Okay. Good information.
Yeah, really good information
Dr.
for all
Coley.
age groups.
Truly.
Dr. Coley, thank you. Appreciate it as always.